special needs, the parent need to educate themselves and they need to become part of a support group so that they can make sure the child is getting the help that he or she needs. Read to the child often, provide homework support, encourage the child to pursue activities he or she enjoys. Give your child lots of positive feedback and encouragement. Get help if you show signs of emotional stress. And I tell you here, there is no child abuse, because many times these children, because their behavior is a bit out of the norm, they get beaten up, they get abused, they get locked up, and high incidence of child abuse in your children. Okay, this picture will tell you 1,000 words of how we need to handle our lovely children. Thank you very much.
Thank you, madam, for your wonderful lecture. Any questions, please? No questions. She gave a very good lecture about these people who are suffering. It's day by day increasing. It's, of course, the statistics is okay, but every day is increasing because the problem mainly needs our food and our mental activities. Because the person's parents, as he said, many of the people are suffering and worrying, and because of these mental problems, we are spoiling the generation also. So please take care of this, your mental activities and your food. That is the two main things, is behind the things for these sort of problems, depends on children. Thank you very much. Now next I call upon Dr. Noor Ashi.
Second presenter from EM Technology, and I'm glad to be here with my team members to present this paper in Colombo for the 51st anniversary. So I'll start with my thesis titled The Effectiveness of Electronic Education on Special Needs Children. So these are all my team members.
Electronic medication है डॉक्टर इलेक्ट्रॉनिक औसत EM ले लेगा electronic medication GP.
My presentation start with abstract and thesis. The objectives are to analyze how special needs children respond to electronic education. Method: participants use 10 children range of 6 to 12 years old formally diagnosed. Children undergo 12 weeks of dosage treatment focused on academic, behavior and skill development. The results was slight improvement in academic, significant improvement in behavior and skill development. Early intervention already started before research. This is completely different from what we have known. You can see you are going to be amazed with what I'm going to share with you along with the slide. And we discover that there are so many children with special needs in the world. You may also have discovered it in your own child when you look at these pictures. Okay, just look at this pretty boy. He's asking help from us. And I promise that, we are going to do our best to help him. And also the rest. Scope of the presentation of my case study covers introduction about special needs, intervention using EM products, case taking procedures, case study analysis, and also the conclusion. Definition: special needs is one term that have many definitions. It is like an umbrella underneath which a staggering array of diagnoses. Special needs children are grouped into various categories, as you can see here. Specific learning difficulties are dyslexia, dyscalculia, dyspraxia, and also dysgraphia. And my member have already explained about dyslexia. Causes, exact cause are not certain. Neurobiological and genetic inherited through genetics, as we know. Brain development, neuronal migration, as you can see from the picture here. Early age hearing problems, fail to make connections between letters and sound. Cross-wiring, use the right side of instead the left side. Make dyslexic work twice harder to comprehend language. Attention deficit hyperactivity disorder, as we call it ADD or ADHD, a group of behavioral symptoms that includes 3 primary characteristics. They are inattention, hyperactivity, and impulsivity. Children with ADD, they are inattentive but not hyperactive and impulsive. And children with ADHD, hyperactive and impulsive but able to pay attention. There are also positive traits. They are creative, they are flexible, they are enthusiastic, they are spontaneous, they are energetic, and they are also try. Have a genetic component, as it tends to occur among family members. Higher likelihood of such common disorders are anxiety, depression, learning disabilities, and conduct disorders. Now I show you these 2 brain examples. This is normal and this is ADHD. As you can see, this is one of the typical brain map patterns seen in a child with ADHD, which shows an underactive, the red color, frontal lobe behind the forehead. Parts of the brain that control movement, attention, social, display lower metabolic ability. ASD, autism spectrum disorders. There are 3 types of ASD. Autistic disorder, as we used to hear a lot, language delays, unusual social, communication behaviors, and interests. These are very common with autism children. Also have intellectual disability. Asperger's syndrome, they have all these, but they don't have problems with language or intellectual disability. PDD, they have all these, but they don't have, they only suffer social and communication challenges. ASD causes, I'm going to share with you. Definitive cause is not yet known. Contributing factors, genetic, suspected to be a large factor. Environmental, higher risk to autistic due to weak immune system from free radicals. Birth injury, maybe we overlook clamping the umbilical cord too early, and also on diet. Lack of breastfeeding, pasteurized milk, and modified food. Okay, when is best to clamp the cord? Study shows that infant with immediate cord clamping had 30% less blood volume during than baby with a side cord physiologic submission at birth. Waiting for 3 minutes allow more blood to flow to the baby and reduce risk of iron deficiency. And anemia in newborn correlates with neurological, behavioral, cognitive, developmental defects in children. Premature clamping may result in brain damage to newborn. Current epidemic of immediate cord clamping coincides with an epidemic of autism. As you can see here, these are the umbilical cord after birth. After 50 minutes, they change colors. So this is the best time to clamp. When the infant is born, the placenta and cord pulse for up to 20 minutes, delivering bursts of blood volume to infant system. This blood burst is just needed for the lungs of newborn to expand. These are the brain mapping, the procedure. A procedure that records neural activities of the brain from at least 19 locations on the scalp. Okay, we use intervention using EC5 products and also therapy. Our therapy, we use health rejuvenator, it's called live body nozzle. And we stimulate brain cell using IQ Max and also IQ Junior. So definition of EC5 water. So the water is 2,500 times finer than red blood cell between 0.001 to 0.004 micron. To know more, visit our website www.ecpywater.com. ECPY Health Regulator, I'm going to share with you how we do it and the function of live body also. A non-invasive procedure to stimulate brain cells. Okay, this is the health regulator we use. It transfer waves to the limbic area. You can see sharp pulses of magnetic energy focus at the limbic system structures. The pulses triggers electrical charges causing neurons to become active. Limbic system, as you know, limbic system structures to control emotional behavior patterns and also skill developments. These are the points I'm going to show before 2 months treatment and after 3 months treatment using the therapy. You can see the face. Okay, this is before the treatment and this is after the treatment. Case study, data collection focuses on 3 core subjects: English, Malay language and mathematics. Evaluation also made on skills and behavior development. Data drawn for 10 selected children with different disabilities from July to October 2013. Case study procedures, scope of studies, parameters of research specifically on the effectiveness of ECPY products on selected children from mild to severe cases. Profile of all 10 participants, as you can see. Dosage of ECPY products, you can see. So these are the bar chart of English test results, the bar chart of Malay language test results, the bar chart of math test results, before and after. Okay, this is my favorite. Behavior before and after treatment. As you can see, it really helps to progress. The behavior, as you can see, before is 28, after 58%. So this is my 2 children with many symptoms, child C and child E. Okay? So before is 60 and after it shoot up to 90%. 90. This is skill development, same thing goes. This child C, 20% before, 42% after the treatment. And child E, she's suffering from autism, slow learner, lazy brain, and also ADHD. Her skill before 20% and after is 45%. This is after 2.5 months using the LPN therapy. Evaluation report before, as you can see here, child C and child E. Evaluation after the treatment, child C, child E. Overall performance, subject before treatment 39.5%, after treatment 63.1%, improvement 23.6%. Okay, as you can see here is a very good progress changes on behavior development 35% and skill development 29%. So this is the best and the shortest time that we can share with you to help the children to improve their progress. Two cases study example. So 8-year-old girl, report from Colombo hospital with left brain not active and underactive frontal lobe behind the forehead. Nick Hakim, before treatment, you can see the eye, and this is after the treatment, the eye is improving. This boy is suffering from left brain not functioning. So before the treatment, low self-esteem and low self-confidence. So this is the QEEG map on Nick Hakim's brain. This is the chart. You can see from naughty and it goes up and become better boy. This is Nurin. You can see the sensorial development On fine motor skill, she can grip the pencil better and very well, very good, and more control, and she can write better now. Okay. Okay, you can see the handwriting before the treatment. This, the handwriting, she still cannot control her hand, and this is after treatment, and she can follow instructions, and she can write within the boxes. Subjective observation for both children: behavior improved in attention and concentration span during class session. Emotion, no more mood fluctuation. Psychology, low self-esteem and self-confidence had improved. Able to perform in lessons and can interact with adults. Academic progress are satisfactory. Analysis. Next. Summary and conclusion. Overcoming developmental disabilities is a long-term effort, as we all know. E-anthology has achieved promising results in this study. We observed attitude and behavior change as fast as 2 weeks after medication. Academic and learning disabilities show only minimal improvement. LBN therapy is most effective in overcoming sensory processing deficits, most notably in the improvement in behavior and social emotional development. We recommend a more detailed study on a larger group of children with and without disabilities, with a more scientific approach and method to prove its effectiveness, so that this new therapeutic tool can be more readily acceptable and in production. As we all understand, these children, they always suffer from behavior, social, skill development. So parents are more concerned on this. So we have found the tool to help all the parents to overcome their problems. Okay, this is my girl. She said thank you to all of you here, and I take this opportunity to thank my teacher, Professor Dr. Hamza, and God has created him to teach us with this knowledge in order to help all of you out there with children, with special needs children. Thank you.